Welcome back, America. Welcome back, Sweden, to your Caribou Data Science channel. Today is Wednesday, August the 4th, 2020. It is, of course, time for your COVID-19 analysis. First of all, as always, a big shout out to the 11 people who watched this video yesterday. Thanks so much to you 11 people. I appreciate every single view I get. So now, just as a subtle reminder, if you haven't done so already, don't forget to click that subscribe button, click the like button, and I'm going to say most important of all, to grow on our channel is to click on that share button. Share this video and the Caribou Data Science channel on your Facebook and your Twitter accounts today. You can also, uh, of course, click the like button and click the share button and share it on Facebook and Twitter. Also, you can also click on that same share button, and that's that. You can also click on that share button, copy and paste the link into an email or text message also. Okay, I came up with a very interesting observation or thought while I was doing another report. And this comes from the fact that last day or two, a U.S. congressman came out and he credited, and he had COVID-19, but he credited the vaccine, okay, with lessening the symptoms of the disease. So in other words, the vaccine didn't keep him from getting the disease, basically kept him from dying from the disease. Now think about that statement, okay? That means in theory, every single person in Sweden can be vaccinated, and yet COVID-19 cases can continue to increase. So this is why it's important for us to always focus on deaths, okay? I don't know about the news media in Sweden, but in America, the news media doesn't want to talk about declining deaths. They want to talk about increasing cases and hospital beds. But as Wush University reminds us, the single best measure of the spread of a disease is daily deaths. Okay. And finally, before we get started with this little sermon here, need to remind ourselves that Sweden only records cases and deaths Tuesday to Friday. Instead, they add Saturday and Sunday, Monday's numbers onto Tuesday's numbers, which of course produces a huge spike, artificial spike in the numbers. So in order to get past this, what we're going to do is, as always, we're going to use a what's called a Loess fitted curve trend line. We're only going to be concerned, rather being concerned with the daily deaths or cases, because we don't know what the daily deaths and cases are at this point. We want to be concerned with what the trend line is doing. Are your COVID-19 cases and deaths, are they trending up or are they trending down? And that's the only conclusion at this point I think we can make from these numbers, okay? So let's go and take a look here. So here's the number, here's what we're concerned with. The spikes, okay? The spikes are the Tuesday numbers. So if you look what happens here, you can see here's the Tuesday number. Here's the Tuesday number. And here's the rest of the week, okay? What we're concerned with is what this line is doing. Unfortunately, you had a long trend line here, but now there certainly appears to be a pattern beginning sometime in, say, July the 9th, first week of July. We're starting to see cases increasing again on a daily basis, okay? So that's a bit of a concern because the trend is all different. Again, and this is a 28-day moving average, so each 28-day period, so each bar represents the average number of COVID-19 cases for the previous 28 days, okay? And what about deaths? You can see deaths overall are trending downward from this high point up here all the way down to here. We saw a couple speed bumps, but the trend continues to be down. Although it does appear to be maybe easing back up a little bit, that remains to be seen. You do see a slight, you do see a slight increase back over here, but what is this? Let's see. So for the 28-day period ending 7/20, you're only averaging 3 deaths per day. Oh, wow. That's pretty good. That's doggone good. Averaging 3 deaths per day. That's doggone good, okay? What about weekly cases? We can see your weekly cases are continuing to remain very low, under 5,000 for a week. Look at deaths. Deaths, this is 125. So this is 75. So this means that right now you're average somewhere between 25 and 50 deaths per week on average for these period over here. This again, these are the numbers we're concerned with. Okay. Monthly cases, look at this. 1, 2, 3 months in a row now you saw a decline in your monthly cases. 1, 2, 3, 4, 5. Wait, 1, 2, 3, 4, 5 months in a row. Wait a second. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6. 6 months in a row, Sweden, you have had a decline in COVID-19 cases, my friends. And this is the number I want you to focus on. I want you to focus on daily, weekly, and monthly deaths. Don't be misled by a talk about cases or hospital beds. Deaths is what's being counted. Diseases are measured by deaths and not by hospital beds or cases. Okay. Anyway, Swede, thanks so much for your time today. And we'll catch you tomorrow with an updated report. Of course, don't forget to click that subscribe button, the like button. Most important of all, don't forget to click that share button. Share this video on your Facebook and your Twitter accounts today. You can also, of course, click on the share button, copy and paste the link to this video into an email or text message. Again, thanks so much for your time. To all you 11 people watched the video yesterday. We'll catch you tomorrow with an updated report.